Dysmenorrhea is the medical term for painful periods, or menstruation, or menstrual cramps. It happens because your uterus contracts to shed its lining. The pain typically begins just before your period and subsides after a few days. Mild to moderate menstrual cramping is normal, but some people have such severe pain during their period that it interferes with their day-to-day life and prevents them from doing things they enjoy. Types of dysmenorrhea. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea refers to recurrent pain with no identifiable cause. Pain usually begins 1 or 2 days before you get your period or when the bleeding actually starts. This is the more common type of dysmenorrhea. Secondary dysmenorrhea results from conditions like endometriosis. Pain usually begins earlier in your menstrual cycle and lasts longer than typical menstrual cramps. This type is less common. What causes painful periods? The muscles in your uterus contract in order to shed your uterine lining. Menstrual cramps happen when a chemical called prostaglandin makes your uterus contract. During menstruation, prostaglandin levels are higher, which means your uterus contracts more strongly. This is the cramping and discomfort you feel. These contractions help shed your uterine lining, which is the blood and tissue that comes out of your vagina during your period. What are the symptoms of painful menstrual cramps? If you have painful periods, you may feel aching, throbbing pain in your abdomen, or pain may be severe at times. Feeling of pressure in your abdomen. Pain in your hips, lower back, and inner thighs. Other symptoms like nausea, dizziness, and headaches. Imaging and other diagnostic tests allow your provider to get a better look at your uterus and other reproductive organs. Your provider may recommend ultrasound. Ultrasound uses sound waves to create images of your uterus, ovaries, and other reproductive organs. Hysteroscopy. Your provider uses a thin, lighted device to see inside your uterus. The device transmits images of your uterus to a screen. Laparoscopy. Your provider makes tiny incisions in your abdomen and then uses a laparoscope, or a thin tube with a light and camera at the end, to view your pelvic organs. There are several things you can do to help relieve painful periods. NSAIDs and other pain relievers. Pain relievers like non-steroidal anti-inflammatory drugs are often the first treatment for dysmenorrhea. These include medications like ibuprofen or naproxen, which you can buy at your local drug or grocery store. Hormonal medications. People who take hormonal medications tend to have less menstrual pain. This could include birth control options like pills, patch, or vaginal ring. Using a heating pad or hot water bottle on your lower back or abdomen when you have cramps. Getting extra rest. Avoiding foods and beverages that contain caffeine. Avoiding smoking cigarettes and drinking alcohol. Massaging your lower back and abdomen. Exercising regularly. People who exercise tend to have less menstrual pain. Minor aches and pains during menstruation are normal. If you get extremely painful periods, make sure you talk to your healthcare provider about painful periods so they can help you. Thank you for watching. Please like and subscribe and click the bell icon to get new video updates. Goodbye.